What happens when the pharmacist and the provider do not agree? I received this prescription. It's for azithromycin, 500 milligrams, quantity of 7. Take 1 tablet by mouth once daily for 7 days. Diagnosis code on the prescription was for a sinus infection. Right off the bat, I know that there is not an indication for a sinus infection to take azithromycin, 500 milligrams once daily for 7 days. Not in the package insert, not in the online drug reference guide. Contact the provider's office thinking maybe it was a mistake or it was sent over incorrectly by mistake. I am essentially told you can either fill it as is or we'll send it somewhere else because this is what the provider wants. Okay, that's not real great communication. So I have 2 options. I can either document it and fill it, or I can refuse it. If I refuse the prescription, it's going to be sent to another pharmacy. There's no other pharmacy in town open. Even if there was another pharmacy in town open, I'm then putting this onto another pharmacist because the providers made it clear they are not changing it. This is what they want to do. They are not going to change it. It's just a matter of how difficult it is for the patient to get the medication. Now, back to option 1. I can document it and I can dispense it. In this situation, is the patient taking this for 7 days going to cause harm? Probably not. There is not an established max daily dose for azithromycin, and there's also some indications where patients do take it longer than 7 days. So realistically, the harm risk is low. Whereas if the patient doesn't start the antibiotic today, or they have to flip-flop amongst other pharmacies, that could cause a delay and an inconvenience for the patient. In this situation, I did fill the prescription for the patient, even though I know there's no indication for this, and I do truly think it was sent over wrong, and I think it's a matter of communication with the provider. But in this situation, I wanted the patient to get their medication and start their antibiotic now instead of having care delayed.